Hello, this is Marq James, your nationally certified massage therapist. Today we're going to be talking about sciatic entrapment issues. Sciatic entrapment refers to when the sciatic nerve, which runs basically from glute minor, the entire length of the leg, gets entrapped by the muscle. Could be from tightness caused by a long plane ride, long driving. It could be because you're sitting on your long sitting and you have a wallet in your back pocket that's forcing this muscle to compress. So there are a couple techniques that I will be using to help alleviate that issue. We're going to start with some friction work. Going to be palpitating the leg, start feeling the leg, softening the tissue up. We're going to then go on to a nice compression work in the area of the upper, the glute minor. Then we're going to do some Swedish work. I'm also going to incorporate some hot rock therapy because you have a muscle that's being compressed, excuse me, a nerve that's being compressed by a muscle, and heat helps things relax. So I'm going to infuse or use some of the rocks that I have on this client's leg to help alleviate the issues associated with sciatic entrapment. Okay? So we're going to start with some friction work. And I forgot to also add some myofascial release. I'm going to use my knuckles. Go up and down the leg. And we'll do this for about 5 minutes or so. We'll start working in a little bit of not exactly 5 minutes, but you get the idea of what I'm doing. Yeah, we'll be doing some compression work on glute minor, around the coccyx area, right here. I'm just going to use my thumb. Another technique we're going to use is some myofascial release. Of course, you see I'm not using any oils. Just going to hold it and let the body release gradually. I'm just stretching that skin. You see I'm not using any muscle work, I'm just leaning in. Let the muscle relax. Then I'll use my fist. I'm just going to walk straight down that leg. Whoa. It's a nice Swedish stroke. I'm also going to use my elbow to go right in there in glute major, and I will sit there. Then we're going to incorporate our heat treatment. These rocks are on 110 degrees. Then we want to progress to the other side. Top of the glute and the coccyx area. I'm also using my fingers to compress. One more sweep with rocks. And we'll just compress it more like glute minor, glute major, slowly. That's just a little bit of part one. Okay, we'll turn you over. Good, good. Excellent. And we're going to proceed with a little bit of more heat therapy on that leg. Legs up. Legs up. Down. Good. Make sure the plank is securely draped. Tuck that right underneath there. Good. Good. One other thing I have is I have another set of rocks right here. Replacing one of those rocks right under glute minor. We're going to have that muscle really relaxed and use this heat therapy right there. Peripheral sciatic nerve does come out on both the left and right side of this leg. And what we're going to do we're going to work on. Just look at my thumbs, pressing like it was walking up outside of that calf muscle. And back down again. And the sciatic nerve does come around the bottom of the feet here, so we'll be doing some reflexology moves down there in a few. gonna walk along that nerve in the bottom of the feet. And we're gonna go up. Finish this off with a little bit of heat treatment. Okay. And there we go. That's a brief introduction to how I would go about addressing sciatic entrapment issue. Okay, this is Marq James. Thanks for stopping in. And I'll see you in my next video.